This week, we travel to Somerville on Victoria's Mornington Peninsula to Aquapaws, where we meet Jo Woolley, an internationally qualified canine hydrotherapist and canine rehabilitation therapist.
Hi, I'm Dr. Kevin.
Hi Dr. Kevin, I'm Jo. Welcome to Aquapaws.
Nice to meet you.
This is our hydrotherapy room, Dr. Kevin. We use the underwater treadmill. Yeah.
Excellent, it looks really good. What do you use hydrotherapy for?
We use it post-surgery. It's great for orthopaedic surgeries, knee surgeries, to help dogs get back on track and help them regain their strength and be able to walk properly. It's great for post-surgery for spinal cases, helps them re-establish their gait patterning, and it's really, really good for dogs with arthritis.
Of course, that low impact sort of exercise is great for dogs with those sorts of degenerative conditions. Have you got any patients that are coming in today that we could see it being used on?
We do actually. We've got a lovely big black Russian terrier that's due here any minute, so we can go and see if he's here.
Fantastic. Look forward to seeing it in action.
Okay. There we go. Come on, Murray. There you go. Good boy.
What a beautiful black Russian.
Thank you very much.
How old's Morris?
Just turned 2.
Excellent. And what does Morris use the hydrotherapy for?
Well, Morris has had some elbow surgery. He's got elbow and hip dysplasia.
Oh, gee.
So we use it to keep his muscles strong.
Excellent. And how long has he been having the hydrotherapy for?
About 10 weeks.
So was he quite immobile before?
Stiff.
Yep.
Inactivity makes him stiff.
Yes.
So the movement
Has really helped.
It has.
Excellent. It's really improved his quality of life, would you say?
Yes, it has. It adds to it with all the other things that you do.
So, Jo, what's happening now?
I'm just filling the underwater treadmill up to the desired level that I want, which adds resistance.
Yep.
I'm just going to turn it off in a second.
And is it warm?
Yes, 32 degrees it is.
Beautiful. Come on. In you go. There we go.
That's it, good boy.
Oh, fantastic.
Murray, move off the side.
In you go. There we go. Good boy. Do most dogs take to it pretty readily, Jo?
They do actually. I think the first sessions, it just takes them a bit of getting used to because they've got to walk and not go anywhere. But most of the time they end up dragging you back in because they love it.
Hi, Kevin. My name's David.
Nice to meet you. You've got a beautiful Labrador here who obviously likes the water.
She does. She loves the water.
How old's Molly?
But Molly's about 9.5, nearly 10.
Excellent. And what does she use the hydrotherapy for?
She's had both cruciates done. She's had her right one done last year.
Yep.
And this year she's had her left one done.
Excellent. A very common injury, particularly in that age group of Labradors.
Yes.
And how long is she through the hydrotherapy course?
She's had 5 sessions so far.
Excellent. And what sort of improvement have you seen through that period?
A lot more leg muscle in her back legs.
Yep.
And basically she's not as lame after, she's not, the legs aren't going out as much.
Yep. So she's got a lot more strength in those back legs.
She has. Good
Excellent.
Girl.
So after the surgery, a lot of dogs are obviously very lame and they get in the habit of not using that leg, and it's a vicious circle because they lose muscle mass, use the leg less and less.
Correct.
Obviously with the hydrotherapy, it makes her use that affected leg, and the muscle builds up and the strength is rebuilt.
Yep, definitely.
So if there are viewers out there that have had dogs that have had cruciate surgery, obviously every patient is different, but at what point should rehabilitation be started post-operatively?
Best case scenario, as soon as sutures are out and the wound's healed up, then they should actually start
the hydrotherapy and rehabilitation sessions.
Yes.
Excellent. And generally the length of the course is about 6 weeks.
Run-of-the-mill program is 6 weeks. That's if there's no complications.
Yep. Excellent. Well, that's fantastic. It's great to see her doing so well with the obviously the time and the cost that's put into fixing a dog's cruciate surgery. This rehabilitation program's obviously worth its weight in gold.
It basically increased her lifespan and increased her happiness at home.
Fantastic. Well, nice to meet you, David.
Thank you very much, Kevin.
Best of luck for the future for you and Molly.
Thank you.
Well, Dr. Kevin, this is Ziggy. He has got a condition called coonhound paralysis, which actually affects all 4 limbs and leaves them totally paralysed.
Gee, poor Ziggy. How long has he had that for?
He's had it for about a month now.
Yeah? And why is he seeing you?
I'm helping him get back on his feet again.
Mm-hmm.
We use a combination of physiotherapy and the underwater treadmill to re-establish his gait patterning and rebuild his muscle.
Excellent. And what's this blue harness for?
We are going to get him in the treadmill. We're going to put him in that harness over there.
Okay, because he's that weak, he needs this sort of assistance.
Yeah, he can't stand.
Okay.
Oh, he can a little bit now, but before he couldn't.
So
Get him in here.
coonhound paralysis or coonhound disease is a pretty uncommon sort of problem. It's got another name called acute polyradiculoneuritis, and it really is a very rapid onset of paralysis, which can leave them completely paralysed from their head down. They often require hospitalisation, and they can be very, very, very sick.
Well, Dr. Kevin, I think I need an assistant today. So would you mind? We're going to take Ziggy into the underwater treadmill here and
What do you need me to do?
get in there with him.
Oh, does that mean I need to get into some board shorts?
You sure do, if you don't want to get too wet.
Okay, Joe, well, that took me a bit of a surprise, but I'll go get a pair and I'll meet you back here in a moment.
Ready, Zig?
Like a warm spa in here, Joe. Sure you don't want to get in?
I'm fine, thanks. Good boy, Zig.
Good boy.
There we go. All right, you ready?
Yep.
Come on, Zig.
Okay, he's doing it for himself already.
Oh, is he? Good.
Yeah.
Come on, Zig. Come on, good boy.
Good boy. He's getting already a bit more tired.
I exaggerate the movement.
Yep.
I even
Hands over his stifles.
I grab him from his feet.
Okay.
That's it.
Yep.
So you move all the joints. Ziggy
Come on,
can't do this for very long. He gets tired very, very quickly.
Yeah, well, with his condition and
Come
how
on.
paralysed he was.
Like now.
Come on,
Come
up
on,
you get.
Zig.
There
That's
we
it.
go.
Good boy.
Good boy.
Come on, Zig. Come on.
He's got pretty significant muscle atrophy,
Come on, Zig.
but if we don't do this, he's never going to get any better.
No. Come on.
Good boy.
That's it. Good boy.
There we go. Good boy.
That's it. Good boy.
Well, thanks, Joe. I've had a really good day here today at Aquapaws. I've certainly learnt a lot, and you do an amazing job with all sorts of animals affected by so many different types of conditions. But yeah, thanks again. We've had a great time.
You're welcome. I've enjoyed having you here, Dr. Kevin. It's been great.
And we look forward to seeing you again later in the series.
That would be great.
Come on, Zig.
Zig.
Keep going. That's it. Good boy.
For more information on Pets Practice, please visit our website, petspractice.tv, and follow us on Facebook and Twitter.